Nottinghamshire County Council has 6 care homes which have been renamed Care and Support Centres. This is to reflect the range of additional short-term services they offer to help keep people independent in their own homes. Respite care offers a break to carers and gives them the chance to recharge their batteries or have a much-needed holiday. It also gives the person they care for a change of scene and the chance to meet new people and take part in different activities.
I wanted the best for my mum. And the more I got to know the place, there's some just wonderful people here. And it's not got ensuite bedrooms and a plunge pool, but it's got the, I suppose you call it 5-star care really, which was quite a relaxing relief to know that my mum was in the best hands.
In the past, respite was provided for a minimum of a few days. We are now looking at offering the additional option of respite for just a few hours at a time if needed, so the carer can go out and do some shopping or meet a friend for coffee. The flexible service is designed to make things easier for local carers so they can continue their vital caring role. The homes will also offer other services to carers, such as a place to hold carers groups. Carers often find it helpful to talk to others in the same situation, to get advice, friendship, and the sense that they are not alone.
The feedback we've had from families has been fabulous. You know, when they walk into this environment now, they feel it's homely, it's just inviting. Inevitably, what we want to try and do is keep people in the community for longer. So we're working closely with the social work department, carers groups, families, just to try and identify what is needed in the community, what we can provide.
From Canada, visiting from Canada, coming to see my mum, who is a resident at Leiver's Court, and she's 84 and getting rather frail now. So I'm just come over for 1 month to spend time with her. They've just made available a guest room. I think of it as a family room, and I've taken advantage of the fact that I could move in here. And apparently I'm the guinea pig. I'm the first person to be using this room, but it's been working extremely well. It's totally changed the whole visit, actually, and it's a huge improvement. It's just great to come here now, and instead of just visiting and then leaving every day, just to hang out. It's just like being, it's a much more home-like atmosphere. It's a wonderful concept.
Some of the care homes will offer a laundry service to people living in their local communities who are at the end of their lives. This will help to take the pressure off the family during a difficult time, so the person can remain living in their own home. The intermediate care beds in the home are jointly run with the health service, and they give older people the chance to regain their strength and independence when they have been discharged from hospital. If someone has been ill or had a fall or operation, they may be well enough to leave hospital, but it can be a daunting task to return home. People in our intermediate care beds will be given time to fully recuperate until they are strong enough to return home. They will have physiotherapy and be supported to develop the skills they may have lost after a stay in hospital, such as dressing themselves or making a meal or hot drink. Assessment beds are similar, but these are offered to older people when they have been discharged from hospital or are struggling at home. People receive intensive 24-hour support and assessment, including personal care and occupational therapy, for a maximum of 3 weeks. In the past, these people may have returned to hospital, but research so far shows that the assessment beds are helping more older people to return to live independently in their own homes.
It's very rewarding to think that somebody comes in and they are wanting to go home and they are able to go home with the right care package, and you're confident that they can manage with that care package at home. People are so happy, family are so happy that the right things are being done for their family, and they do feel as though it's a positive move for them.
Future plans for some of the care and support centres include the development of community transition units. These are self-contained flats where people can live temporarily to see how well they get on when they return home. The flats will have their own front door, so people can get used to having more independence while still having the safety net of support at the home if they need it. Specialist units for older people with moderate dementia and mental health needs are also being developed at some of the homes. Staff at Leiver's Court in Arnold have helped transform part of the home into a street scene from the past. This has helped to engage residents with dementia and create a welcoming environment for visitors. The home features a public house, a sweet shop, a cafe based on an old Lions tea shop, and a cinema offering ice creams during the half-time interval. Many of the residents came up with the ideas for the centre, including a lady who used to work in an original Lions tea shop in London, who helped to design the cafe's decor and layout.
We worked with the service users to actually come up with ideas. It really got everybody's imagination going. It's energised the staff, which has been important, so that the staff have seen the change and seen the improvement with the service users. The service users have been involved in everything. I think it can be quite easy for someone to think that they perhaps can't play a part in their own care and in their own environment, when actually we're giving them the ownership, because it is their home. And I think once people realise that they can make these suggestions and build on it, it really did snowball. I mean, there were so many ideas for names for the shop and for the cinema, and that it was incredible, and the memories that it sparked in people was fantastic.
All local communities are different and have different needs. Each of the 6 homes will link with their local community to find out what services they need. For example, some areas have a higher level of dementia, and others will need a greater number of assessment beds. By talking to local people, the homes will be able to develop services that meet their needs. And by offering the right short-term flexible services, we will help more older people retain their independence and live in their own homes for longer.